all across the country. House Democrats have repeatedly made clear, as have Senate Democrats, that we will not support a partisan Republican spending bill that continues to gut the health care of the American people. We are here to address the serious needs of everyday Americans that have repeatedly been undermined throughout this year by Donald Trump and compliant Republicans in the House and the Senate. The Republican health care crisis is very real. The largest cut to Medicaid in American history. Hospitals, nursing homes, and community-based health centers are closing all across the country as a result of what Republicans have done in their one big ugly bill. The fact that Republicans continue to refuse to extend the Affordable Care Act tax credits means that tens of millions of Americans are about to experience dramatically increased premiums, copays, and deductibles that may double, triple, or quadruple, meaning many will pay thousands of dollars more per year, which will make their health care unaffordable. Republicans have also set in motion a $536 billion cut to Medicare that will occur at the end of the year if Congress doesn't act because of toxic provisions in their one big ugly bill. Medical research has effectively been halted in the United States of America. And Republicans are proposing dramatic cuts to the Centers for Disease Control and the National Institute of Health. We're witnessing an all-out Republican assault on the health care of the American people. It's unacceptable, it's unconscionable, and it's un-American. And that's why Democrats are standing up and fighting to decisively address this crisis that our Republican colleagues continue to visit on the American people. It's now my honor to yield to the distinguished whip, Katherine Clark.
Thank you so much, Mr. Leader. Here we are again, another no-show week for Republicans, another week closer to the ACA open enrollment period, another week closer to a catastrophic GOP-made healthcare cliff. This is a solvable problem, but it is an urgent problem. And we need Republicans back in D.C. at the table and negotiating. And that needs to happen now. Despite what Mike Johnson says, we do not have an eternity to deal with this. Families are already finding out their premiums are about to skyrocket. Parents are realizing they cannot afford to stay insured. Let's take Shauna Verstegen. She's a mom of two in Wisconsin who says she is sick to her stomach because her monthly premiums are about to rise by $800 a month. That's $9,600 a year. And for what? So Republicans can cut taxes for the billionaire class at the expense of everyone else. And I mean everyone. This is not about party or ideology or geography. Let's ask Alan Reynolds, a proud Florida Republican. His wife has been notified that her premiums are going up $700 a month. Alan said, "I voted for Trump. I did not expect this." We are hearing stories like this every single day. Yesterday, Mike Johnson said he didn't have a strategy. Come on, Mike. Don't sell yourself short. You do have a strategy. It's the same strategy the Republicans have always had. Repeal the Affordable Care Act, take from working families, raise their costs, defund their health care, and give that money, all that money, to the very, very wealthiest Americans. It is a losing strategy. It is an unpopular strategy. So, Mr. Speaker, for the sake of your own constituents and mine, why don't you try a new strategy? Come back to work, take a seat at the table, and let's stop this healthcare crisis you created before it's too late. And now it is my pleasure to yield to the outstanding chairman of our caucus, the gentleman from California, Pete Aguilar.
Thank you, Whip Clark.